In our previous video, we talked a lot about some of the anatomy of the pelvis and how the two sides can both shift and how a lot of those muscles can play tug of war with the front and back of our pelvis, all leading to some sit bone pain. And we often will feel that pain when we're sitting for a long time. It'll ache as we go to stand up and move. Sometimes there'll be an ache there as we're trying to exercise, walk, or jog. And so today we're going to talk about things that flare that pain and might have led up to you experiencing that pain. Two of those are pelvic asymmetries. So again, going back to the anatomy and how these two sides can shift this way, and front to back. And so when we address this, we want to make sure that we're fixing that pelvic asymmetry, right? So what things that flare it can often be related to asymmetries with sitting on a hard surface will often increase sit bone pain, like a pew or a bench. A lot of sporting events can be problematic for that. Sitting on the floor, trying to play with your kiddos, or even sitting in a bathtub can be very problematic if you're already having some sit bone pain and pelvic floor tension. And again, most people don't attribute this to the pelvic floor at all. We're just not aware of all of those muscles that play such an important role in the two sides of the pelvis and that symmetry. So if you're having any sit bone pain, make sure to avoid sitting on a hard surface right now. Work on exercises that help create symmetry from side to side. And stay tuned for our next video. We're going to give some more specific tips and stretches and things that you can do to make sure and address this thoroughly.